Welcome back to the clinic.
Thank you so much.
So good to see you.
For having me. I'm so excited for this conversation and just like delve into
Get into it.
Yeah. So thank you. All right. Right. So we are back with Dr. Ejikeme. This is episode 2 and it's the same session. It's just we're splitting it up and we're going to continue our conversation into, tweakments, treatments and technologies and all the things that sort of fall under aesthetics, but as they pertain to women that look like me and, and women of color, Black women in the beauty beat community. And so one of the areas that is, just huge, is hair and hair loss. Even you'll know if you've been here for a while, I've had PRP with Dr. Ejikeme, for, hair loss that I had sort of postpartum. Just me, just one woman. I have elders, aunties, friends who all have some form of hair loss, whether it be the hairline, edges, maybe it's from sort of, different hairstyles, but maybe it's genetic. There's also ladies in my life that have, hair loss on their crown, which is nothing to do with, sort of tension or anything like that. So again, I couldn't really do or have a conversation around treatments without delving into hair loss. And I think that's probably all I really need to say on it. I think that we then just want to hear from you. What causes the hair loss? What are the options? Can we, reverse time? Can we solve it? Are there preventative treatments? What really works, what doesn't, and that's
okay. So the huge topic of hair loss,
just that little, we're all depending on you, but what can we do? What can we do?
So the truth about hair loss is that it's always multifactorial, and that means that there are lots of different things that contribute to hair loss. That's why when you just do the one thing, take the one supplement, everything doesn't get better. It is really due to stress, hormones, your nutritional status, because the body will only invest in the teeth, the hair, the nails, and the skin after it's invested in things like the vital organs, like the brain and the heart. So this is important just to remember. So things that are happening to you generally tend to affect the hair.
So so basically it feels like, which I've never thought of it like this, but the hair, skin, nails, teeth are getting like the leftovers.
They get the leftovers.
So if there's no surplus there in terms of nutrition, in terms of, that kind of real richness, then those are the areas that will sort of instantly suffer. Okay.
So in that vein, thinking about when there's a chronic medical condition going on, it tends to affect the hair. So things like hypothyroidism, we saw it over COVID, all of these types of things can affect the hair.
Okay.
So the first thing I want to do is to split hair loss into the main 2 groups. You've got one type is scarring and one type is non-scarring. And this is really important because the non-scarring type means that the hair may fall, but it will come back.
Okay.
The scarring type is important to recognize because of if the hair falls and you do nothing about it and it keeps falling and you keep doing nothing about it, that hair that's gone won't come back. And so I want to spend a couple of moments in helping you identify things that can fall into that group.
That would be great.
The first is a scarring type of hair loss and then non-scarring. So non-scarring means the hairs may fall, but they will ultimately come back.
Okay.
The second type is really important to identify because if hair falls and you do nothing about it, those hairs will not come back.
If it's scarring.
If it's the scarring type. So it's important that if you have hair loss, you go and see a doctor. You go and see your GP as your first point of call. Tell them you're worried about hair loss and let them review your scalp and refer you if needed. Because if you fall into that scarring type of hair loss, there are things that you can do to stop it. But if you do nothing, it will just get worse.
Okay, so let's take a step back. So 2 types of hair loss. Hair loss that is non-scarring, hair loss that is scarring. But you're going to delve into what we can do for both. But I lose hair. When I'm washing or combing, when it's got conditioner in. And again, I know this is very general, but what does normal hair loss look like, and what does non-normal hair loss look like? When should we, at what point should we be going to our GP to identify the 2 types? But what is normal? What should we be doing when we're combing our hair on wash day?
So hairs are in different phases of growth, and there is a phase of growth that is just about hair shedding. Okay, so it is normal to lose hairs every day, and anywhere from about 100 to 150 hairs is normal to lose every day. Now, if you've had your hair in braids or in a weave, you've got to calculate that up. So it's going to be quite a ball when you take it down.
Okay.
But if you're washing your hair and there's hairs all over the floor, there's hairs on the wall, or you're worried, that's enough that you're worried, something has changed for you, then go and see your GP. That's your first point of call. They will do a full examination, they'll look at your hair, and then they will refer you on if they feel it's necessary.
Okay.
So it's really important. Now, I want to spend a moment talking about scarring forms of hair loss. The reason why it's important that if it might be you, you go and seek help.
Yes.
But it's important to say that this is the minority.
Okay.
The majority of people that have hair loss fall into that first category, and we'll talk about those.
Okay.
So this category, the scarring form, there's two types. There are many types that are associated with different medical conditions, but there's two types that I think aren't talked about enough.
Okay.
Because they are treatable and they're common in the uncommon part. They're most common.
Okay.
So the first is something called CCCA, Central Centrifugal Cicatricial Alopecia.
Let's just go with CCCA.
CCCA.
Yeah.
So this is a form of hair loss that usually starts in the crown of the hair.
Okay.
It starts small and it gets bigger. Nobody fully understands why it happens. In the literature, it says maybe it's due to hot combs or things like that, but nobody fully understands. But people often describe intense burning, itching, or pain, and then the hair falls down a few weeks later. And it kind of starts small and it gets bigger and bigger and bigger and bigger.
Okay.
So if you do have pain or sensitivity, a lot of pain in the middle of the scalp, when you're seeing some hair go to your GP. Don't worry about it. Just go and see your GP, say what your concerns are. That's what they're there for. And they will review you and refer on to dermatology if needs be.
Okay. So what we're saying generally, again, this is all sort of quite general because everyone is individual, but generally two types of hair loss.
Yeah.
And what we're going to talk about sort of the most common type of hair loss, which is the hair that can grow back. But for a minority of
real
ladies, a real minority of ladies. And there are women in my world that have got where it's just the crown, and by the crown we sort of mean that sort of top of the head. So if there are ladies or men or anyone in your world that is feeling sort of, you said, a sensitivity, pain, itching in that crown area,
and you have hair loss and you're worried,
that's combined with hair loss, you should go and see your GP.
Why not?
Because if those symptoms are indicative of CCCA, there's treatment.
Yeah.
So I suppose that's the key. There is treatment, and I think that's probably when I think about CCCA, although I'm today years old and I knew it had a name. When I think about it, I always think about sort of some of the sort of ladies that I've seen, and it's very progressed.
Yeah.
But what we are saying is that there's possible treatment that would stop it progressing to kind of the whole crown.
And it's important to say not all hair loss in the crown is CCCA.
Okay.
So if you have that, there's a small chance it might be that. But if it's that, don't do nothing.
Yes. Yes. So the reason that we're talking about, CCCA, even though it is quite rare, is because it's treatable.
Yeah.
So I think that we just want to talk about that in case there's just one lady who's having sensitivity, who's having itching or pain combined with hair loss in that crown area. Go and see your GP.
Yeah.
It doesn't have to progress. There are possible treatments, and possibly, hair can be saved. So I just wanted to sort of say that before we go into the more common types of hair loss and sort of other treatments we can do.
Yeah. The second one that I also think is important that we touch on, again, because if you do nothing, it progresses. And if you do something, it will halt it where it is. It's frontal fibrosing alopecia. And this is when literally the hairline walks back.
Okay.
So the hairline literally walks backwards. And again, you may have an auntie, someone in the community that you can identify, oh yes, I can see what that is. Again, if that's you and you think, oh gosh, my hairline just seems to be just scooping backwards, there are other things it could be. There are more common things it could be.
So we're not just saying that if, a lot of the time it is, I've been guilty of this before, where, you have a great hairstyle and you lose some of your edges.
Yes, yes.
We're not talking about that.
No, not necessarily.
Alopecia. We're talking about where it's literally walking back.
So
that's when you need to seek medical.
Exactly. So if you're worried, it's really important. If you're worried about hair loss, there are things you can do. You don't have to get loads of money and go see something privately. Start with your GP.
Okay.
Right. Start with your GP, get an assessment. Your GP will refer you to dermatology if they feel that that's necessary.
Okay.
So I think that's really important. Often I'll see people who are quite far advanced and they'll say, oh, you know what, I just thought it would go away, or I was really busy. You know, the years pass by. So if you're worried, get some help.
It's interesting that you say that. And again, this is, you know, one of the reasons why I wanted to have this conversation, because, you know, in the times that I've had hair loss, and mine has only ever been on my edges. I have never once thought about going to see a GP.
Your doctor.
No, I've thought about, you know, going to the hair shop or, you know, buying some sort of different things online. You know, and then even when it got to a stage where it was, you know, my hair loss at the front was, you know, quite apparent and was starting to bother me, I came to see you. And of course you're a doctor, but you're not my GP.
Not the GP.
But it didn't enter my head to go to the GP. And so I think these conversations are really important.
And why the GP? The GP, because hair loss is usually multifactorial. They will talk to you about all aspects of your life that may be impacting your hair. It's not just, is it scarring or is it non-scarring? It's what's driving this. Is it the hairstyle that you're using? Is it your iron levels? They'll do blood tests. They'll speak to you about stress. They'll talk to you about all the different aspects. They'll also know your medical history. They'll know whether there's some medication that you're taking or something else that may be driving this. And your hairstylist, your esthetician, they won't know these things. So it's something that's available to you. It costs you nothing. It reduces your anxiety. And if they feel actually something's going on here that's more than this, you get that referral early.
Okay. Yeah, makes sense, ladies. So, if you're worried about anything with regards to hair loss, if it's feeling, you know, if you know that you're experiencing hair loss, whether it be in the crown, whether it be, you know, the edges, anywhere on your head that isn't, you know, a direct result of a hairstyle, potentially, we've all been there. Go and see your GP. And so, we've kind of covered, excuse me, the more serious
and the rare.
And the rare, the rare kind of instances of hair loss. So if I have got hair loss that is, you know, just, you know, from, you know, just general sort of, excuse me, general hair loss, what treatments are there? What can we be doing? You know, I've had PRP. It was amazing. You've seen the results. But what else could we be doing? And what is PRP? For those of you that perhaps haven't seen my journey with PRP, what are the options for, you know, hair loss that for follicles that are still alive and hair that can be saved or regrown?
So in terms of non-scarring, there are lots of different things that can cause non-scarring hair loss. You may have traction alopecia, which is what we're discussing now. If you've had a tight hairstyle and it took away some of your edges, or if you've been unwell and the hairs have fallen back, but they're coming back. So you and your GP will discuss what's driving it. Once you've figured out that it's something that is reversible, it's something that just needs topping up, then you look at, again, holistically. You do have to still check your bloods. Vitamin D, iron levels, thyroid levels, these things can affect hair growth. Then we look at topicals that we can do for the hair, and this is all about stimulating the hair. Now, one thing that lots of people don't know about is that there's a medication you can get over the counter that doesn't require a prescription called minoxidil. And minoxidil works by increasing the blood flow to the hair follicles. It works. You can get for men it's 5%, for women it's 3%, and you can buy it without a prescription.
Is this Rogaine?
It's Rogaine, Regaine, all of them.
I know. Yeah, of course. I mean, I remember those adverts from when I'm giving away my age, but I remember those adverts from when I was younger.
So that's something that's available.
So you don't need a prescription. You can buy it over the counter. It's topical. Obviously, read all of the sort of, you know,
the small print, and the small talk print. To the pharmacist.
But that's something that you can just buy and you pop on the area of the hair loss.
Exactly. You pop it on the area that you're having hair thinning, and it increases hair growth. It works for as long as you use it. When you stop using it, you do lose some hair, but you can discuss this with your pharmacist.
So that's a really important thing to note, it will increase the blood flow. It will increase growth.
Usually.
Usually. Is this evidence-based?
Yes. It's probably the highest level of evidence in terms of things you can get over the counter.
So that's extremely.
It's actually a medication, but because of it's so prevalent, it's something that you can get without a prescription. You can get higher percentages with a prescription, but over the counter, you can get that without a prescription.
But it's key to note that when you stop using it or when you stop applying it, you know, the blood flow will reduce back to whatever it was before, and then that way you may lose some hair and that growth will stop. So it's a temporary fix.
It's a temporary. So it basically works by the phase of growth where your hairs would shed, it reduces that.
I see.
So when you stop it, all the hairs that would have fallen then fall.
Right. So what we're saying is hair grows in a cycle. There's some moments of that cycle that are falling hairs and growing hairs. And what minoxidil does is pushes all of your hairs into a growth stage, but then they'll fall out when you stop using it.
It reduces the shedding phase.
Okay.
It doesn't push, because we have a growth phase, a resting phase, a shedding phase, and then it reduces the shedding phase.
Okay. And how long, again, everyone get their own medical advice, please.
Yes.
I said it. But is that something you could use long term? Would you use it for years and years and years, or months, or whatever?
You can. Some people get irritation, some people will switch, some people want to stop using it. But it's something that people kind of bring into their routine if they want to maintain that growth.
That's good. All right, so that's something you can just sort of pop out and buy if and when you want to.
Yeah.
And so what would be another option?
So other options are then in-clinic options.
Yes.
So in terms of evidence, the next thing down would be microneedling.
Okay.
So microneedling is
which is what we talked about last sort of on face. So it helps your skin, but also obviously your scalp is your skin. But
yes. It helps. It has to be done in a very specific way.
Right.
Very superficially and with very specific settings to make sure that we're stimulating hairs, not damaging the hair follicle. So done in clinic, these are, again, the treatments that can stimulate hair growth. So microneedling is very good. Another option is PRP, or platelet-rich plasma, which you have done.
Yes, I've done.
And that's where you draw blood and then you spin it down and you separate it into the constituent parts. And we inject back the growth factors. And the growth factors, the platelet-rich plasma, is then injected into the scalp, which stimulates growth as well.
Okay, so first instance, we've gone to the doctor, we've hopefully identified, our bloods are all okay, and all of that sort of background work.
Yeah.
Then we know that the hair loss that we're experiencing is non-scarring.
Yeah.
And so then we can pop along and buy some minoxidil. We can then do microneedling in clinic, or we can have PRP.
Yeah.
PRP I found it really, really helpful and got some good regrowth. And out of the two, if we're looking at microneedling vs PRP, what would you say would be your sort of, again, depending on individual cases, but what would you say are the benefits?
So in terms of evidence, microneedling probably tops PRP a little bit.
Right.
But it depends what you're microneedling in. So microneedling can be a really good way to introduce something to the skin that can then stimulate growth, the skin of the scalp, that will stimulate growth more. So with microneedling, we often are putting something into the skin or near the skin, and that could be in a medical setting, something medical, or it could be something that's more of a botanical to encourage growth. So depending what you're microneedling in, it can be an exceptional treatment. But PRP by itself is fantastic because as you've seen it, especially for traction alopecia, or if you've had some event happen, you've lost your hair and it's coming back, it's your own body.
It's your own sort of,
going back inside. And there are others, there are others like exosomes or low-level light therapy, but we're now moving down in terms of levels of evidence.
Okay, so what we're saying is in terms of the evidence, which is kind of what I care about and why the conversation I want to have. I'm sure that there are many, 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 many things out there that have worked for lots of ladies, but in terms of the evidence and the science, we're talking about over-the-counter minoxidil, we're talking about in-clinic microneedling, and that microneedling would, as you were saying, would generally be combined with a treatment. So you would be putting
something into the scalp,
feeding something into the scalp that would help with that growth.
And that's important that you discuss that with your doctor. So if you're seeing a doctor, dermatologist, then they will discuss, and there are medical options, I think it's outside the boundaries of what we're talking about. But there are medical treatments that are important, but I don't want to talk about those because I think it's important that you discuss those with your doctor.
Fine. And then so those are the things that you can do in clinic if you decide that you want to see a doctor or a dermatologist. And then there are things that, ladies perhaps are doing at home or have seen sort of, so if we're doing, red light therapy on our head, is that beneficial?
LED or low, so there's two different types.
So LED light.
There's LED and then there's low level light.
Right.
And you can get helmets that do low level light.
Yes.
So there is evidence about low-level light, and it's helpful for certain types of non-scarring hair loss. So there is some evidence there.
Yes.
Now, LED by itself for hair loss does not have great evidence. They look quite similar.
Yes, because I was just about to say, oh my goodness, now we're
They
like,
look similar.
what is, so my little device at home, and obviously I have your mask.
Yeah.
Is that LED or is that
LED.
low light?
That's LED,
Right.
predominantly made for the skin of the face.
Yes.
Helpful for healing. So if you have something that you want to heal, that's great. But low-level light is a laser.
So there's no point me walking around my house like a madwoman with your mask over my head. Is that?
Oh, you maybe make you feel good. I don't know.
No, there's no point. Okay, right. That's good to know.
In terms of evidence-based,
Evidence.
low-level light,
Yes.
there are some helmets and
Fine.
that say, and they will say low-level light treatment.
Okay. Yeah. So the key is, I think, there is that when you're looking, they look similar, right? To
Very
me,
similar.
I thought up until today, I thought that the LED at home was the same as the low light.
Low-level
I didn't know
light,
that they were different because they're both red.
Exactly.
So,
yeah.
so what we're saying is, if you're going to be buying a helmet to help with hair loss or hair growth, it needs to be low light,
Low-level light.
low-level light,
Yeah.
not red LED light. And guilty, I thought they were the same thing.
What makes it more complicated is often it will be both together.
Fine.
They'll put red light because there's a bit of evidence, but low-level light is the thing that has the most evidence, and you just have to do your research there. You know, make sure that it has a CE mark. Make sure it's it's.
But no, that's really good to know, because I didn't know that there was a difference, and I have been known to be putting the red LED on my head top. For no
I do the
reason.
same thing, to be honest, because there is a bit of evidence. If I'm doing it at home, I'm okay with it.
Okay. All right, perfect. So that kind of like covers us on LED and low level light.
Yeah.
And what else? Is there anything else we could be doing? And I'm going to ask this question. We're here today to talk about medical evidence-based solutions.
Yeah.
But, I always see online, buy this oil and buy this, sort of cream or potion, and, you'll have a hairline of the gods and all of that
amazing.
sort of stuff. What should ladies be thinking about that? And this is not to comment on a specific product, but it's just, is an oil or a balm or a cream going to give us back our hairline?
So I would say it's more about process rather than product.
Okay.
So are you washing your hair infrequently, once in 2 months? Are you putting a lot of relaxers in your hair? Are you using a lot of heat in your hair? Are you conditioning your hair and deep conditioning your hair? Are you sectioning your hair and protecting your hair? These things are going to be more important than one specific oil.
Great.
And the other thing I would say is supplements is a field that you could go wild with supplements, and there are loads of claims. Use this supplement and it will grow back your hair.
Yes.
Again, just like with skincare, you have to be doing the basics first.
Yeah.
You have to be taking care of your hair, washing your hair, letting your hair out, really taking care of your hair, deep conditioning your hair, looking after your hair.
And also looking after your internals, your diet and all of those sorts of things.
Reducing stress, all of these things, in order for your body to be able to really invest in your hair. Okay. If you're not doing any of that, there's no supplement that will then circumvent all the issues in the body and just affect the hair.
Yeah.
So it's really important. General health is very important for healthier hair.
Yeah.
And the biotin. The biotin.
Yes.
So biotin, there are lots of brands that have biotin in their ingredients. I do like a multivitamin. But the evidence behind biotin is very weak.
No.
It's extremely weak. It's important people know this. So there's a medical condition that the body doesn't produce biotin.
Right.
In that medical condition, there's no hair, completely bald. And so what happens is you then supplement in that individual and their hair grows. Now, you and I and the majority of the population produce biotin. That's why we have some hair.
Yes.
And there's no evidence that adding more biotin is going to increase your hair. So there are other things that have much more evidence, like having a general multivitamin, maybe pumpkin seed oil, maybe pumpkin seed oil. There are some other things. So please don't go out and buy like a biotin and think, okay, I've got my biotin, therefore my hair should grow. The evidence around that is shaky at best.
Okay.
And, as long as you don't have a medical condition that's no biotin in your body, just leave that one alone.
I did not know that. And I absolutely, hand on heart, have been guilty about sort of, every now and then being like, oh my gosh, I don't have a biotin supplement, and trying to find, you know, the strongest possible one. So I didn't know that. So thank you for sharing that. And, you know, that's, you know, and that I think the thing that is, it's such a minefield. There's so much information out there. And so you go for what is sort of spoken about loudest.
That's right.
But
Yeah.
I personally, I've never thought about pumpkin seed oil in terms of hair or, you know, growth.
But
so,
again, pumpkin seed oil by itself will do nothing.
No,
If you are deficient in like iron
Yes.
and B12 and vitamin D, like your hair is so much more impacted by those.
So it really goes back to, you know, going to your GP, getting that kind of overall picture of your health, what's going on inside, if you're worried about hair loss, or if you're just wanting to kind of maximize, you know, that cycle of hair growth.
Yeah, absolutely.
Okay, brilliant.